Hi everyone, you are welcome to this video and we are really so grateful to have you on this channel. I want to welcome all our dear visitors who have freely joined our YouTube channel. You are most welcome. This is GAF Medical Videos that is featuring a community-based organization from Namusindwa district, one of the villages or one of the remote districts in the country, Uganda. So our aim, what we are doing is to extend eye care services to the grassroots or to people who are in villages. Remember, even when a person becomes blind, is always sent to villages. That's why we want to start at the grassroots to give out eye care services. The eyes, at first, people can be assessed about nutritional stand and also the blood pressure and also blood sugar. So we are fundraising and we are using our donation app, either the Patreon app or you can use the Buy Me Coffee app. So we are really so grateful for the step moved. So far we are around 10% on our fundraising. So we welcome more people to buy us a coffee so that we can be able to really get these instruments into play. So we are trying to extend eye care services to all groups of people, all the vulnerable groups of people, so that we can be able to dispel blindness, which can be prevented. So if we can really do it as early as possible, we can really dispel blindness out of our population. I'm going to share in our links in case of any support towards this. We want to get instruments like a glucometer, we want to get the BP machines, so that we can be able to screen these people. And besides the screening of eyes, we can be having preliminary tests like the BP measurements, checking the blood sugar. Yes, what we are saying is that most causes of blindness constitute around 80%, and they are always preventable, where we talk about cataract and other chronic diseases. And once early awareness is done, I know we can move a very big step and many people can keep their vision on. So what we are talking about today is the treatment, general treatment of diabetes. For us to have best general treatment, it starts with early detection. So the first thing is to have all people checked, most checked for high blood sugar. So once we check them and we know them earlier, we can be able to manage them well. And the first thing, the way we manage it is to do what we call non-pharmacological treatment. Non-pharmacological means that we don't use drugs in this case, but we can have diet modification, changes in the diet, whereby we can be avoiding foods which have high uh, glucose or high sugars per kilogram mass. So it is important to embrace non-pharmacological treatment, and it is most of the things that I always share with people so that we can be able to avoid or to treat diabetes. So besides the non-pharmacological, we have also the pharmacological where we use drugs. And in this case, we have the two forms. We can either use the drugs like metformin, glibenclamide, all these tablets that we can use, oral treatment, or we can use the injectables, whereby in the injectables we always use what we call insulin injections. So when we use this, we can be able to lower down the blood sugar as long as it is detected early and managed correctly under monitoring. So that's what I intended to share with you, and I request everyone to support us to get these instruments so that many people can be able to be helped and managed as early as possible. So thank you so much for watching. Invite a friend and visit our donation apps. Thank you. Bye bye.